You are watching Liberty Online TV.
This is Liberty Online TV powered by Orange Sierra Leone. Orange.
Liberty Online TV, the 1 year this November, and you know what's in that mean.
And throughout the month of November, na celebration period. And as you know, na time where you for coming and support Liberty Online TV for continue for doing work.
And the way how we go support Liberty Online TV for continue for the online, na for send we you support.
Now for send we you support through the orange money number where you see on the screen and the other bank details them as well for make we continue for do we work. This na Liberty Online TV 1 year celebration. Na Liberty Online TV, all voices count.
This one way we all friend we safe, now nobody own. You wanna get what you want, we go down to belly.
As Liberty Online TV, the 1 year inside this November, we dey celebrate this anniversary with different activity them. And one of them, na hike with Liberty, we get for be Saturday, November 16. Usa we go waka go na the Mambo waterfall. The Liberty Online TV team go then na Mambo Junction, they wait for una 7 o'clock na morning. For join we, na 300 leons no more you go give. And you go get the Liberty Polo and water, and you go get all the enjoyment. We get for being at the waterfall. If you want for join we, you go come now with 33 Battle Street office as the Polo then already now, or call now this number 074 200 545 for place you order. Now Liberty Online TV, all voices count.
Wednesday, the 23rd day of October 2024. Nasa go say good morning and welcome you to another edition of the Breakfast Show where they come to you live on Liberty Online Television. We will bring come this edition of the program this Wednesday morning. Mina Mabel Kabade say good morning.
And Mina Al Hassan Kuma, good morning. Today, now Wednesday, October 23rd, and inside this edition of the Breakfast Show, we will look at health sector with a special focus on the medical and dental association and strike. This plus many other issues inside the program. Continue for stay with as we get plenty for discuss inside this edition of the program this morning.
All right, well, as another hearing from Al Hassan, today at this edition of the Breakfast Show this Wednesday morning, we can look at the strike action where the Medical Dental Association, we made up of doctors, them they begin today as we don't give notice of ultimatum to government. We don't elapse because according to them, they say they not get an assurance from government yet regarding the condition of service, specifically the fuel supply where they say they're supposed for they get quarterly. Where according to them, for a very long time, the fuel supply be done they come, but they're not consistent and they not be done they get them on time. Well, we can look at all the issues here and how it will get for affect the end users them, when the patients them where they out and different hospital them, because the doctors then say today then they begin and strike action. How this going to affect the general public, we go discuss them inside this edition of the program. And also now the program this morning, we get other issues and we'll go for look at. We go for go to the Sierra Leone Police, also we go hear from them regarding a letter where the All People's Congress APC Party been write to the Inspector General this BNT Musa then raise concerns to them believe say government they interfere with the continuous detention of them party member them where police be arrest the day where the All People's Congress APC Party be they meet with the international community regarding a meeting where they can do for follow-up on the previous one they don't do for talk about peace at the country. Well, all of the issues here then at the program this morning, and members you safe where they watch can send you message to the number +23274200545, or also drop your comments at the comment section at the different platform them outside the watch with this morning. And don't forget, Liberty Online TV, we don't launch your anniversary projects. We've been see a message them where we don't send already regarding the celebration. We get activities them where we don't plan. For ensure say we mark this celebration, the very first one we did to the public. Now the one we got for happen on the 16th of November. Osai, the team and all others believe in Liberty Online TV got for join me for Hike with Liberty as we go converge na the Mambo Junction and Waka go na the Mambo Waterfall. And for the part of that, na just 300 leons. You go get for gi, and inside that 300 leons, we go give you a t-shirt, and also you go get water. And when we reach there, whatever glad you meet there now, it's on you. And also not forget, we got forget the grand climax of it all. We got for be on the 29th of November, where na the dinner and dance. Also, we go get for go jam, but you get opportunity for meet the whole team, get pictures with we and all of that on the 29th of November. And I've been telling you the ticket price them yesterday. The ordinary ticket price for the grand dinner and dance now 250 leons normal. We get Patron single, where na 6,000 leons normal, and also table for 3, where na 5,000 leons. While the tickets are already, in case you want for buy your tickets ahead of time, you can just come now with 33 Battle Street office or call 074 200-545 for let you save the part of that. Alassane, you're well prepared, right?
Most definitely. You know, say early way Liberty put Tampa, you know, not the best. So we want to encourage we followers, we viewers, them we don't watch you over these past years. But like we be part of this celebration because you know this is the festive season, and plenty of people can look for glad particularly the same. So of course, with the hiking, we now one of the most prepared activity we Liberty Television they bring come to you. We that get to happen on the 29th of November. So we encourage you for be part of the celebration. Of course, if you want to get more detail, you can still come out 33 Battle Street office. You will forget more of the information so we bring come to you inside the program this morning.
All right. So we continue with the breakfast show. Like I tell you now, we're going to the Sierra Leone Police force before we can look at the issue of the doctors them strike. We're going to the Sierra Leone Police for hearing from them. As we've been see a letter where the Secretary General for the All People's Congress been write to the Inspector General of Police who said and raised concern regarding the continuous detention of the member them, where according to them, they believe the government they interfere for let them continue for hold them party member them. Well, for let we get the side of the police regarding this allegation where the All People's Congress APC Party make inside this letter where they write to the Inspector General, where they join at the virtual link now, ASP Mohammed Bobson Senu, a Deputy Head of Media and Public Relations at the Sierra Leone Police. Good morning and welcome to the Breakfast Show.
Yeah, good morning, Mabel, and good morning to people of this country.
ASP, we kindly ask that you adjust your camera of your phone as we know they get you full picture at the studio. Adjust the camera, then we try for link you so that you will give you an update regarding the police position for the letter where the All People's Congress APC Party writes to the Inspector General of Police. Like I don't tell the viewers them, there is concern inside this letter. Say them believe say the government they interfere with the continuous detention of them party member them. The one them where especially on be arrest the day for the meeting where the All People's Congress APC Party been gets with the moral development partners them. And inside this letter they may also copy the international community, development partners and other people regarding the kind way where they say police detain them, then support them and continuously detain them. Firstly, let me just know the Sierra Leone Police will not respond to this. But the allegations of the continuous arrest confirm false if the Sierra Leone Police will make any arrest of the All People's Congress APC Party member them the day where the party be they meet with the moral guarantors them.
Yeah, thank you very much. I know you now get me well, and I audible, and you see well. First and foremost, we investigate any political matter. You understand? And indeed, we arrest 28 suspects for various riotous offenses under the Public Order Act. We been get a from the All People's Congress that they get for meeting with the international moral guarantors, where they for come meet with days on the resolutions where they be don't go sign, where they get for do with the National Unity Agreement between the APC and the SLPP. So based on that, say then get a rumor of some people who are really bent on on that day that they can create mayhem, disrupt the process. So on that note, the police was informed, and in as much as we get the responsibility to maintain internal security, we also regulate the behavior of people in line with the law. So on that note, police officer being there day will make a deployment, and a set of people being calm, behave disorderly, we is against the law, and upon that we be arrest 28 uh, people who misconduct themselves on that day at the party office day. So we conduct the investigation. They enjoy autonomy. We not get any interference, any instruction from no. We get the Inspector General of Police. We get the mandate to control and direct the operation of the Sierra Leone Police. We arrest based on the fact they committed an offense. On that, they were called upon to investigate them. So as I talk to you, after investigate, we don't release them. So based on the evidence we have, we also get in touch with other members, because you talk about resolution 4 of the unity agreement where you say for release, and then others are saying they are not political party members. But since the response from the all people, we say come up as responsible institutions for make a whole statement. Yes, we responded based on XYZ, and we acted within the confines of the law. We not violate nobody, right? So based on that, we issued that a press statement. Now the SLP position that one day.
Politically motivated detainees them. Let we go back to the one them where you say una behold the day where the APC be they meet with the moral guarantors them. You say una be hold them for disorderly behaving in public. What are the specifics of them behavior yeah, where them people being put up? Where make the police be hold them?
Well, when we talk about disorderly behavior, we get places where we refer to as public places. If I enter a studio, I do things where they are against the ethics, the norms of those and that place there. I don't disorder. So using obscene language, behaving in the way we are in, again, they are against the feeling and the feeling of others within that premises. Is tantamount to disorderly behavior. So based on that, we arrest them, and they were not arrested from any other part. They were arrested on the heights. So we are based on the fact they commit an offense. So they were under our detention based on the fact they get something to answer, they get something to respond to, and that was the reason why they were arrested. Not based on anything because they are APC member or they belong to APC party. We arrest them based on the fact they commit an offense.
And one of the responsibilities of the Sierra Leone Police are for ensure say una maintain law and order. And the Constitution of Sierra Leone states and clearly say una can detain person but you not for go beyond 72 hours without charging the person. And from where the issue happened to when the All People's Congress APC Party been right to the Inspector General of Police, if it don't go way beyond the 72 hours, what's happened?
Now, well, basically, when we talk about investigation simply now, they start and today. It can happen. You start and today you end based on the circumstances. You understand? So we work within the limited time that we have. You understand? To ensure that we work within that limit day. And there are also negotiations on the side of the APC. Whilst they were in custody, trying to say no. Well, let me move over. And then equally so, we are trying to say no. They hold somebody, you put on a cell, we not take statement from her. You understand? So we do all those things to ensure that we follow the process. And when the due process be complete, we hand it over. Nobody we are humiliated. Nobody they not beat nobody. So basically we follow the due process to ensure that the right of them one and they also we not go be tampered upon, and then we also equally uh, do we own responsibilities as required by law. So that was just the process.
We actually don't mention so I don't really see 28. We have been all doing the protest. Is it like una be there under pressure from the All People's Congress at that particular point say we una be holding 28 suspects and we make una release them?
No, well, as I start the word by saying the police we independent, right, and we get we constitutional mandate to maintain internal security vis-a-vis the protection of life and property. So we not get any pressure from nobody. It is systematic to ensure say the due process are followed. Even when they say una handover, we ensure say the due process follow. The due process is key here, right? Because nobody no need for tell me say arrest this person. First thing will come to my mind for which offense. Upon your arrest, now you right for know the reason of your arrest. Follow all those process for tell them say you arrest because you misconduct yourself in the that go against the well-being of other people. At that place, they outside the APC party office, they now a kind of a center of the city where the resident in the day and a main road that one day where people they use, and that equal not to everybody be equally involved in that process. That process day at that particular time, and therefore their movement not going to be impeded by any other person. So equally so, will be the try for ensure saying the right of them people and they will then say for use that road day. Then the benefit of that right. They enjoy the free movement. The movement will not be impeded. So basically, these are a kind of issues we are faced with to ensure we live up to expectation. I believe we do what requires the police for do, and that is why when they issue out that press statement, we come out with your position based on what requires the police, and that's exactly.
Now, the All People's Congress APC party member or supporter them waiting at police custody any parts of the country right now?
No, well, I'm not going to able to tell you. Basically, the time of investigating political issue, it fall within the mandate of the PPRC. If you require police, we can go there. Basically, as I'm talking to you now, we not get anything like that to say we get any political detainee in police custody for any. No, anyone we hold. We dey hold am based on the fact you commit an offence, either criminal or any traffic related or else. We not get any political detention, detainee in our custody, as I talk to you.
Resolution 4, now the agreements where government been go into with the All People's Congress, then be agreed say them for release people where police be done all based on political perhaps now the party office or them be at activities them were related to the All People's Congress APC Party. So are you saying nobody not in a detention when an APC member based on that resolution where government be done sign with the party because now this not in concern?
In police custody, I would say in police custody, we not get anybody with na SF, APC, or any other political party member in our custody case. Police custody, we not get none.
Studio, ASP Mohammed Bobson Senu, Deputy Head of Media and Public Relations, now the Sierra Leone Police. Thank you. We give you the updates regarding concern with the All People's Congress APC Party being get. Inside one letter, we then be write to the Inspector General, where then be asked say then concern because then they feel like government they interfere with the continuous detention of them party member them. But according to ASP, the one them way the police be arrest 28 of them, where then be all the day where the APC be they meet with the moral guarantors them instead they don't left them. And according to Ram, no political detainee no day under the police custody, and as the state said then go arrest people, but not because of their party affiliation. Well, Liberty Online TV will continue for bringing you updates regarding the concern where the APC party gets for the resolution where they've been signed with government. We continue with the breakfast show.
All right, continue for watch the program. We bring on to you now the breakfast show as every morning we can therefore bring on to you issues across the country. You will be part of the program through you will send a text message to the number +222 742 545. That the number where you will send a message or you drop your comments now the platform outside you the watch we from.
All right, so they continue and we tell you today we look at the strike action where the Medical Dental Association member them they do throughout the country as them they don't give ultimatum to government, the ultimatum elapsed. What they expect, they not get them yet from government, and today then decide to say the strike action they start. For can help we talk about this later in the program, we actually go for bring you first-hand information about what's they happen now the different health facility them right now where they under government as the Medical and Dental Association they on the strike. Now the studio this morning. I want to welcome we guest when Dr. Peter Mark Jajwa and the Secretary General for the Sierra Leone Medical Dental Association. Good morning and welcome to the breakfast show.
Yeah, good morning, Liberty TV. Good morning and thanks for having me.
All right, yesterday and also we've been starting the discussion, but we've not been getting enough time on the phone for let we exhaust the issues then because we all know say they can say well body agency and if una way suppose for the ensure say people and where they go to the health facility then get care, una get concerns and that it get for be of public concern because una suppose for get waiting una wants for let una self go able for do waiting people and they expect of una. So let me just go back. This is not the first time where we did hear you say the Sierra Leone Medical Dental Association they go on strike. Not to the first time this like how we've been talking no more yesterday at the program. But waiting at this continuous issue with the Sierra Leone Medical Dental Association and that of government through the Ministry of Health and Sanitation. And we just want for states clearly here so we make attempts for let we go get somebody from the ministry, especially from government, for letting dinner at the studio this morning for talk about the issues them within Dr. Yagets. But at the end of the day, nobody not being able for come at the studio. We several times call the minister, send message, call other people and for let we ensure say somebody dinner at the studio. But unfortunately, they're not able to give anybody yet for respond to them concerns here. But like they ask Doc, waiting at this issue, we don't make long-standing concerns them always on the come we surround on our welfare. Waiting upon.
Okay, once more from good morning. Indeed, as I say, we don't issue 21 days strike notice. We end yesterday midnight. But before we go into the program, because we don't want to make like this left and good and no, then we will address that issue there. We as doctors then, we always get good at yesterday in the evening after we don't get engagement with the government and all, we reach out to members then and we don't decide at least for expand for add 7 more days to initial 21 days. So today, remember that they go as usual, but we get another 7 days, more see what the government will do because we know the implication exactly. I think that one of the reasons why make like we feel that they take advantage of with the medical professionals because they take and say we let the patient there, we don't go back and see person they suffer without not, we know sit to and with profession they can train for more get empathy, for more get compassion for the person because well body then are everything. If we not be going about this money, we don't know what to do now. You will be educated, you will get all kind of money, but if you not get well body, trust me, your life will be as ordinary as any other thing. We don't get people that we get all the money in the world, where the money not able to save them because they don't get well body. So we get all this consideration there. But for kind of to question, why would we get issue with government? We feel say over the years, we get fundamental issues there. We as Medical and Dental Association, and we the part of the civil service. We technically, if you look at them with all the provisions of the civil service, we not even fit into that service there. Because one, in terms of working hours, we go way beyond waiting demand for the ordinary civil servant alone. If you look at weekends, we know the part of the civil service, we work on weekends, where the other civil servants don't work on weekends. We get entitlement there, we for the gets. We even pay blind eyes to her. This year should not be entitlement. We doctors over the day for we who big one, they do not ever if you get that time they for look into them, say we forget them. But time changes. Now the economic trend of the world and everything make always a doctor that would not know how to satisfy because most of our life what we spend our power. You see that we do patients, we study, we don't even care, but wait till the go on. We always want add the latest knowledge to we self because of we believe say people they forget the best of care. A post kind of hospital today, things that they change. Way of diagnosis they change, ways of treatment they change. We get new interventions every day, people get updated. So they spend much of the time doing research, going for type of updates to say. So for more get time, even for read laws there, we the government, we don't get that time there. But because of time changes, in 2022, we can't realize it, before they get fear. And that time then they want to know how the price of fear don't get rocketed over the years. And we can find out especially the young doctors, that we made up of over 70 to 80% of our association. We are doctors that we don't practice for less than 5 years or even less than 10 years. We then doctors, the salary, they use half of her for maybe transit to work, for able make ends meet. We do not get that opportunity. Maybe we other established doctors then get for able to take care of their families and other things. So basically, after that, they use our salary for go work 7 days a week, not even 5 days a week, 7 days a week. They use that for go work. At the end of the day, they be left with nothing. And besides the way they don't say you're a doctor, the other man has died. If say that either get all the money or you get all the waiting. In fact, the okay pass all man, but which is the exact opposite. And honestly, when I go up there, if you allow doctor for begin think of for making ends meet, there's possibility it can go into an illegal practice. It can begin to see the way illegal. We don't not permitted. We really say doctors that before we left for things straight for things of education because too much man you know who that would before that doctor day. You know know if I'm go before.
Well, doctor, just like you don't mention some of the problems and challenges that we don't face as civil servants in the country. Because if you look at the medical field, we get a vast role for play for see that we are able for give the right treatment and give the kind of support to treat patients every can at the hospital. Before they make this ultimatum, how best be able to engage the government? Because whenever this goes down to the public, it gets one or two issues away, psychological, effects to the patients and the public with regards to doctor them for strike and all that. So how best probably don't they engage government for let this not reach to this far of making an ultimatum of strike?
Okay, so like just get background back. Let people try to understand exactly what would it try for ask for. This is not only a new demand. This is not something we statutory by law if it happen. So because of that they happen, we don't even say for even remind government for letting give. So sometime back in 2022, after we don't realize this now we're entitlement, we get a memorandum where government to the Minister of Health be signed with we, and they promise say they would go this field. Then at the initial point, we know the society will leave. That first 6 months, we are surprised. We get everything. After we don't forget the first 6 months of the year, we get the last 6 months of the year. Coming into 2023, we can't be get issues. The first two quarter of 2023, we get some storming block. 2023 done, we lapse into 2024 without to not get the third and fourth quarter of this entitlement. And after which, what we do, we try to engage the responsible authorities. We engage them and tell them, say, that is not the issue. And there are even at some point where the executive engage the Minister of Finance, where they say, we more forgo the last 2 quarters of the 2023. We are really amazed. It's something we're entitled to when I go more forgo, and so after we don't hold to that point day, so we get so much back and forth to say, no, that's not possible. They finally end for GUI for the last 2 quarters of last year. Now we come into 2024. 2024, first quarter, second quarter, July done, August done. We don't hear anything. And we reach to the ministry informally first and try for know what they go on, what are the issues. We don't say any headway. We formally write the ministry on September 10 and express with dissatisfaction and say this don't happen. We feel say this is not right and unfair to we. And we get a lot of pressure from our membership. And our membership made up of young doctors there. We feel say these are the list of things. These are the list of things that we can ask for. Because if we begin ask for things that we're really entitled to, then that would be lot and lot of chaos. And if we ask for the list of things, then we get this kind of issue. What will happen if we begin really ask for things that we know say we will be entitled to, we not forthcoming. And we express with dissatisfaction in that letter they write to the ministry. And in response, the ministry say, well, not to them are the problem. They don't do all they for do on the young part. They don't send the check na finance don't approve the paid form. The check they open a BSL for the BSL pay. That then check they be that BSL for over a month without they don't honor the check. Till September end, we come into October. Now say no, this one it don't be too much now. So we say, as an executive, we will take decision unanimously. So we call a general meeting and we members there. And members they become more agitated, and they are like, we talk and say these people don't take us serious. The only word way government they are in for strike. And when if we want to talk about strike, that time they were and we after this don't good. We don't need to go to the extreme for let authorities they listen to we. Strike for be the last option for it, especially we in terms of healthcare workers there. As I rightly say, if we talk say with the strike, definitely that's a problem on people that outside there. We know this 2-3 days that can cause what I don't get from friends, relatives, authorities, from other people there. Any doctors when they strike, when they waiting, when they stand on a part, with a big one, you understand it in the. But at the same time, we say we not like any other Sierra Leonean.
But based on what you just say, you don't think the authorities in take on now for granted say, when I just get for threatening say when I get for strike, where they know say at the end of the day they go negotiate with una last minute and when I call off on a strike action, you don't think say then they say and now say I just threaten when they threaten them?
I want to know say doctors there, we are very intelligent people in our society. Yeah, if they take it for granted, then they left to them. What do they think of now the general public? And one let public health understand exactly. We see will be that 7 days, not by an easy issue for Richard. It'll be so waiting because I know they talk that was a clear thing. This is what they do, definitely. They will take for granted, say, now threat will be threat, and they go for go back. And we actually hope, say, they not will repeat. Because we believe, say, if they make we get to that end day, and say, pass going to threaten, before ever they give it, and not to threat. I want them more make a category clear, it's not to threat. You just be say, as in opening statement, we as medical doctors then, they train, we forget empathy, and if anybody strike in our society, drivers then strike, people that go stranded for transport, but at the end of the day, they go much easier than destination. If you then strike, people that go on also 1-2 weeks or waiting, but when they go able to attain the knowledge where they lost with that period. But if doctor then strike, anybody die, that person never come back. That's not the waiting. So let don't take you for granted because of the kind hard to get, or because of the kind we honest.
How serious when they as an association, for push government to then responsibility, like you actually mentioned that the responsibility of the ministry or the government of Sierra Leone for give out them fields into the different hospitals across the country. What we don't see what may happen a few months back, what may happen at Cottage Hospital where one became died because of lights, not be there and all that. So how then hospital and they don't they cater, when the supplier when they come, how they run the hospitals?
So as you say, we're able to take decision, we slowly take a decision because of we consider so many factors. We're very slow in taking decision, but that not mean say we will be taking for granted. Say we don't know what to do up to. As I say, we as doctors there, we level of intelligence and with knowledge, we consider so many factors. We need just grab in the morning and say, this is what I do. That make even if they arrive at this point, when everyone said let's still come to public domain because we know it can psychological impact. If from that 23rd we don't send 21 days ultimatum 23rd October, if we don't come to the public domain, during that time day to now, there should have been so many actions. But honestly, if you say government for don't respond and will solve this thing without the public, if you can't for let the ordinary man know say, hey, now this is gone. But if they allow for get to this point, we the public don't can get an ear out. We don't see the public for understand what part say. Now we don't give them another opportunity of 7 days because of we don't want let life them be lost on the side because of doctors not there. If anything for happen, let this say the person get the honor and the best of care we require. Now hospital and let this now from an expert. So now we don't cause all that thing because we know the as I say, a doctor then strike any life loss, that life not going to come back again.
Doc, how serious the association thinks the government is taking on issues? Because taking into consideration, you said without to the facts, not to the first this, when they call for waiting belong to una. But anytime when the time they reach, una must say una want for strike before they intervene. And according to you yesterday, what una they ask for now for let somebody just the way they sign in and agree say una they get what una want and una they get it on time. We don't seem for be difficult from that of the Ministry of Health and that of the Ministry of Finance. We're supposed to process the documents then for let this happen. How serious una thinks that they take on issue? Whether assurance una not able to forget them from government.
So as I clearly see, if you ask the ordinary doctor out there, young and old, of course we as medical doctors there, we senior doctors there, if you watch at this whole thing, you don't know come out and show face saying that this day happen on and because of the way we train and they want make sure say we preserve the integrity of a profession. But honestly, from the depth of each and every doctor, don't go this mindset say one, doctors don't be taken serious. Okay, I just give you this insight. Recently, some doctors them in the form of dissertation, they do a research. Like they try for know what a doctor the perception for the routine salon for practice as a doctor. And going to for let you know say 30% of doctors then today 30% of doctors wey dey not even 500 or 30% today they ready for left salon today for left no more they don't want left they don't want know what to get for happen but they don't want left the country and go other side because they feel say outside there are better opportunities and which is the fact because doctor left here today ago all they need for do now for sit down for maybe 2-3 months you study and sit the country outside to go their exams and Sierra doctors, they even want to go on external exams. We are performing, so nothing is that impossible. We feel say also the way we be trained. We have been trained for come out with the best. Now make even when commerce like even recently, where so many people enter inside commerce, we see the outcome because we know they settle for anything less. Now make when we never come on commerce, we feel that. So 30% get it for left today, and 50% of doctors there. They're not even sure if they want they are or not. But reasons because of maybe some people don't start family, so man they think of other things there. 50% not sure, see the one they are. So only 20% of doctors they sure see okay now one as alone. So with that kind of trendy, we go to call silent strike. Silent strike now the fact that we need to talk anything, we know they protest. We don't even ask government for anything. All what they do is now for find ways and means as the trained doctors that have now for let them left the country. Who they all don't train on, let the who say would that go be a disadvantage on the government side. Time will come we like we go watch one so kind doctor, one post we not we need people there for take over we to go and don't start. For so long now salon we get specialization on just one person daily. Now the doctors there recently we don't go would into active specialization. So don't you like all this thing that would into active specialization. And recently we go like those they go attend exam. We get like over 20 specialists there. We just this 2024 we don't see we perform extremely well na the sub region. So if they go on come here go na Ghana, we doctors they will go on the exam. We are performing better than them. It just means we don't have access to the basic tools and other things there. So let put up if we left alone it is so people are urging for left because if you go perform on the other side then they value you, they identify you as possible get potential and they just hijack you and waiting. And people that will not get option for left, they are going to other things.
That's just like when you talk about the specialization of with doctors in Sierra Leone, and the public relied on the medical field for able to give better offer to patients them all across the country. Just like we as well when they ask government for waiting due on, how holistically you go assess the doctors in Sierra Leone in terms of delivery.
I must say, honestly, this one at the talk, you can quote me, you can put me any side. We can in terms of the doctor, the Salon, and the sub region, the Ghana put a fit for who, the Nigeria, the Liberia, who go into any external exams, we go in terms of diagnostic. When they do diagnosis in a year, but we can't get the tool for work with, where the patient go inside, they will be amazed. They are even surprised that was this made in Sierra Leone. So we get the knowledge, we get the capacity, we get the potential. What's lacking now the diagnostic, and which is another factor where they strain with a lot. So we believe with all this compounded now with basic welfare. Imagine if they struggle for work, for get access to basic diagnostic. Where you say you get the position for able perform your work at an optimal level. Then they alone na problem. Then you combine them with your basic welfare. So you don't forget if you get they have opportunity they get say today at the left salon, in the left, and maybe get a second thought for waiting. And whether they suffer at the end of the day, whether they happen, now the ordinary man.
Because that's what I ask you, say, of all the things them, una critic them, waiting and they focus on now, of all the things them we get for do with the health issues them na the country currently, why na fuel the doctor them focus on? Waiting at how they working environment like for una na the different health facilities them, when are the fuel paramount on at this time?
So I want let people understand one thing. As I talk with the feel are the basic thing of all. Then are the basic thing. So I make all this.
So every other thing they in place.
I mean no. Every kind of thing I was imagine the basic thing not in place. So if the basic thing what they request for, if it not day. The basic the officer will not for the ask for itself. Officer will not for the request for itself. If that they act forget. More just put 2, 3 together and look at the bigger picture. We are not really one going to that at this point. Going to that point, but we critically say, out of all other things, why making a fuel with the act so now? Because of the fuel, it's as simple as this. Now we entitlement, now we use for go every day. At least we use for go help you where you see. At least if you get that problem, they will go help for say, okay, this one if you get this medication or you do this for her, it go well. That feel then they able for go now for work. But if you not do so now, then be not going to get her. So at least when I was speaking, say if you don't get the opportunity for do the test there on next day, if the doctor with the intelligence, because we get who to cope medicine, clinical acumen, where basically means say you don't get the equipment for like get a final diagnosis, but you use the clinical acumen, how you interact with the patient, how you assess them and say this person here or doing able to do this, but if I take this decision, they don't say.
So there are more issues where they way beyond the fear.
Exactly, but the fear then are the basic for we. Then they make doctor want grab this money. For like go and take motorcar and go work for able to deliver for Sierra Leone there.
This field what we talk about now, how many liters each doctor they get?
So per week if now 45 liters, per day it will be 9 liters. That even we don't factorize the weekend inside it. So imagine how magnanimous will be enough because of the civil service say 45 liters per week, 9 liters per day. But we still work out together. If we not be waiting, we not say a doctor will go quickly for get fear. But we not be asked for that day. We not if they ask for that day. What to ask for? When I just give you the civil service code prescribed say go 45 liters per week. That's all. Because we get asked for that thing a day. If we begin asked for the year issue, then trust me, it will be a problem.
So also
we never want if honestly, if government can just do justice to we and not allow it more go in that line for being acts of things that we feel we really are entitled to or they forgive we. We feel if we ask for anything and then we need to get up and we pay food so we'll get up, we will get up.
Also the bottleneck day for the government supply on our fuel because we all aware say other government institutions and the way equally they get fuel cheats where they can able for take them fuel them without any grumble, not the common halala, not the day. What's the bottleneck day for let una get access to una yon?
So the access to yon, as you rightly say, they will not do for we. So not if na prioritize, they don't prioritize we like doing that then period, but it's always complain about finance. If yes, I don't go the meeting na that, and government they operate on how they collect revenue. That like on daily basis, how government collect revenue per day and then they updated over the month, then pay salaries when they are the priority, they do that in a way government is a priority, then the one we don't left, the balance we left, now they will consider say, okay, this one more get up to the tier or this one more do this with her. So all the excuses is about revenue. And the interesting thing is, at this point, maybe reach 600 doctors there who get access to this year. And we are talking here, say, the country need over 5,000 doctors. So now 600 doctors they struggle for get fear. Yeah? Less than 600 doctors they struggle for get fear. And imagine now, commerce don't produce very large number of doctors. In the next in the next 5-10 years time, we know they go above 1,000. And even with that day, if people then decide for stay, because people are actively going every day. Maybe class of graduates, if I tell you say out of 45 will be come out back in 2019. If I tell you not reach 20 they will right now as alone. You would say. And up to this point, people are still exploring option for them. So maybe in the next 2-3 years, maybe reach 5 of their number they will left.
Is it because of the encouragement when they within the field make plenty of them people in the field?
Environment. That's all thing. It is struggle for do you work. Then at the same time, it is struggle for even get the basic welfare. So some people not just left for at the end. Let me tell you, see, that's what they call silent strike, a bad pass through they do now. And we can decide say Salomon can get show. We need ask again. We can just wake up and say, okay, more let go learn with the one. We need ask again for what you waiting for. Let all man do what you want. You are a doctor. If you want left, if you want going to research, if you want to go into academic, if you want to do anything, and any other doctor go, trust me, 1 week for 1 reason or the other, he must excel there because of waiting. So you can do that day and silently waiting. But tomorrow, if you wait, person need certain intervention. You go to hospital, they don't get that doctor they for go see you. See how painful it will be. Or you go to hospital, the hospital overwhelmed. Maybe the doctor will like the hospital will get at least specialists for guide the young doctors the way they come, for train them, for guide them, because it's all treating this thing about the transfer of knowledge. You forget person we don't be into the field for very long, for mentor the one the way they come up, for let them know. The over time that was a take over. So imagine if the one that we now wait for past knowledge to the injection they come up. If for one reason or the other one decide say, no, me I'm not asking me, I don't want to wait for left, or me I don't want to wait for loud here, which is quite possible, very very possible today if doctor begin explain to you say one left, and they tell you for left. And if you left, you go any side, if they excel me, you must get a job. Because medical profession, not a profession, will get bad luck. That's the fact. Even I make countries like a first world country there, don't they joke with the healthcare system. Don't even allow patients for pull out of your pocket for pay. You know what I mean? The insurance. And at the end of the month, the government through the insurance, they pay the doctor what he deserves. So if you put a left here for go Ghana, they know we don't put away like if they go na government hospital. Next to Nazi, we they see there. For that same condition, if they left here, then go. By the time where they left, Ghana, where they come between. Doctor Fabio say, I don't go because at the end of the day, after they don't request for this, at the end of the day, what the medicine they give me, I see they also more continue with the same medicine. So you don't see. So for more be that towards the and more we say we can do it. It just need the equipment, not allow the doctor them for being able to think of the basic need and fear when a list of things.
You make mention of trust. On Monday this week, when I've been get a very long meeting with the ministry, where till the day done, I've been still communicate with Una, when I not be ready to show any resolution yet. The wish was when I begin strike today. Yesterday, said the same thing. Day to the last time, what I talked to you, nothing not be done change yet regarding the strike where for happen today. Now, waiting different where the ministry tell Una, we make Una believe say they will look into Una concern, we make Una don't add a 7 days ultimatum again.
So, not really the ministry we do waiting for. We just take the word see. Maybe this time around they will keep to the word. Yeah. Yesterday meeting be a bit different because we get so many stakeholders there. Minister of Finance be there, Ministry of Labour be present, the Attorney General be present, of course Ministry of Health and other stakeholders there be involved. And during that meeting they will give the word say they will set up committee, we will follow up the process for make sure say this criteria not repeat. No, that they all will listen to. Waiting will communicate to membership like that. Now, we don't get this engagement. Of course, we get trust issue with these people there because of what they don't happen in the past. We believe say politicians they will talk one thing to tomorrow they will do different thing. But at the same time, for the public, for the ordinary Sierra Leoneans, we will grab this money and go na Mama Kevo in Bikina Cottage, you know me doctor. For the ordinary Sierra Leonean, woman, Bella woman, we will go na cottage, you get complication, you don't get doctor for able to intervene. For the ordinary Sierra Leonean, we will grab this money, cannot connote for a health condition, when a doctor get the knowledge for able to intervene. That big with the big one. More just only by the word because of the people we involved. Until at that level they don't make commitment. The membership, more just they can see, they will do them. If they don't do them, we always get window. And the public will clearly not see. Now, we as doctors there, because of Una's sake, because of the impact we will get for Una, because of all these ABCs that we don't give, we believe say we as doctors there, more go. Would they go not because of we don't know we left from we right, not because of we don't know we right, or not because of we are stupid, or not because of we don't know say they take it for granted. We know all that in it, but will they go work for the ordinary Sierra Leonean and will they hope say they will keep to the word. If they don't keep to the word, then the Tema will take a decision. If the public will not say these people they do everything possible for make sure say they can arrive at who said they like now because of the not out there. You know that point they will like you don't push for to the wall now. We now say this one the only way. Now for that affect for my life now. We know how to that point.
So that you feel say action will be taken after the 1 week on I don't give government. If not able for solve at all, now you feel say now will take immediate action.
We dey hope for that day. And if they not solve that, definitely we'll go in that line day. So now let Saluma know see, let each and everyone know see, we don't give window of opportunity for more of this problem. We will be give before, but authorities they don't take her. Now we don't get other one. We do it because of we are doctors. We do it because of we get comrades, we get empathy. We don't want to see person they suffer. And this same story now they use against we each and every time. Because some people, maybe it's when they put with you, that's the clear thing. Where they come out. Now this same story we don't let pan. When they are direct today. But at the same time, if we not extend Soriat to the ordinary Saloma, we not extend the Soriat for let we save lives. Then the ordinary Saloma na go for so far. And we believe say for more into that point day, more exhaust each and every window for let people know say indeed we do what we for do and we try our best, but we not get any other options again.
But from experience where I don't get with government regarding this on a fear issue, when I think that they don't learn anything from the past, because also the first time this one they stage up strike action for Seka on a fear.
Honestly, me I don't know if government they learn no. So we don't hope say they don't learn. Now that we hope. As I say,
from the last time when I've been complaining to now, anything change with our interaction with them?
I can't say that not much no change. But at the same time, the only thing we changed yesterday, we get different parties that were involved in terms like negotiation table. And we get Ministry of Labour who believes say like a neutral ministry in the sense that they advocate for the labor rights of all civil servants and government employees. With the OPC, with all the people that are involved, it will be a different case. But at the same time, we still get that window of opportunity and we believe say politicians go talk one thing or they will make one commitment, but other different thing will be. Would the hope say they don't learn? Would the hope say in the near future, we don't get to that point, they'll start for issues strike notice. And if that happen in the near future, trust me, if they miss this opportunity, we don't give them now. If they feel this opportunity will happen in the near future, if this can't happen, well, they will be mistaken.
Yeah, Doc, just like we really push government for letting take up their responsibility towards the doctors then. I want to bring this question again with regards to the delivery, the service delivery to the patients in plenty of hospitals across the country. You know, obviously, plenty things they go wrong at the hospitals, and also you can see nurses or doctors and not able to give the kind, support to patients whenever they go for seek medical attention.
I must tell you, see, if any patient go to hospital, you meet doctor there. Now if you compare now to before, if you go now any government hospital at any time of the day, 24 hours around the clock, you meet doctor there. Next time one doctor you must meet there. Because we believe see if will be in that kind of format. The more Israel could push for the more doctors they not left the country. Because if more doctors begin left the country, we go back to that older days, where maybe the way we meet doctor na hospital, na during the day, we go na net no meet doctor because you know overwork one person, overwork. Where at the end of the day, instead of get life, then you end for make a health condition deteriorate. Because as we said, I'm not like any other Sierra Leonean. We're not immune to anything. We can get burnout. We'll get fatigue. But the more, the merrier. If more doctors than they, and they encourage for stay within the country, then the better opportunities we'll get for deliver healthcare service. Because now, first time you go to hospital and the doctor will meet at the hospital on call. Maybe it will be doctor with jog like 1 or 2 years experience. But now they are showing say if you go to hospital at any time of the day, you must meet doctor that we get at least 3 years experience and above.
What about the facilities then for the hospitals?
The facilities there, let me I'm not going to begin going to Dande because then a whole other thing for the day. Dande, like the best put there, now the Minister of Health.
But now they get the first-hand experience. Now they the facility.
Exactly. You know, you are perfectly right. What you can do, where you go, if you need this and this, what you say, now this and this you need for do.
And then this and this and this. The reports where we get now that when you go now some of the health facility are even paying for rights, paper, waiting the doctor for his gloves, then they ask patients them for give something for them able for purchase them.
So at some point, of course, no doctor for pull my pockets for buy gloves for patients. That's not the responsibility only and solely for the government. No doctor for, of course, the pen we go buy for my salary, we go buy a paper no day, we go for A4 paper, we will write panel. That's not the problem. But if the other because like we get 2 types of healthcare within us alone. I want to put them understand on the back. We get one. We have below man and under 5s, we don't have free healthcare. We don't go to hospital, don't need to pay for anything. We are free. Yeah, then are only the responsibility of government for take care of the in terms of the labs, the investigation, what they for do and all. We're not the responsibility of government. The other set of people then we are like me and you, we not in that category. If you go now hospital, what you need for do, basically you pay small, you go there. That will much lesser than if you go to a private facility. If you need to do tests, the doctor will go give paper and give options. Say, one, this test here, they do inside the government facility here. You can do one day. Or this one available within here, you need to do them outside. Because of ABC reason. Example, if you go to Connaught, you need to do CT scan. Because CT scan are available within Connaught, we'll tell you CT scan are available within Connaught.
But apart from them scanning there, the consultation fee, what they ask is basic thing like gloves. When are aware say some hospital the way you go in a government facility, then they ask patients them for give money for let doctor they able to get that. So
me as doctor, we may go to a facility, we may the work, yeah. The make all the work in which with the nurses there. When patient come, we don't admit them. I don't talk to him from and say. Because we get process, we go to call history, or know how the sickness starts, what it happen, and I don't forget. Or I don't know and they, what do you mean in gloves at the end of the day? I don't want to know how the patient get the gloves. Or what do you mean is why I need for examine patient, especially patient one knows I need for use gloves on, I forget gloves.
So that the patient
if I don't get gloves, if the patient will not fall under the free health care,
so
then it's not available within the facility. At that point, the patient got option, partner got a provider. If not free health care, then the hospital need for provider.
Alright, Dr. Peter Jajua, continue for the within the program in the Secretary General for the Sierra Leone Medical Dental Association. There this morning we talk about the strike action where they don't extend 7 days more ultimatum to government for ensure say they put everything in place for letting get them fuel supply them as and when necessary as according to the agreement we then get with government as the right for get them as per law. Well, we continue with the breakfast show and members say the time from the studio clock now. Now 9 o'clock we go for this short commercial break and come continue for look at issues we get for do with the doctors and still.
Liberty Online TV the 1 year this November and you know what's in that mean.
And throughout the month of November, na celebration period. And as you know, na time where you for coming and support Liberty Online TV for continue for doing work.
And the way how we go support Liberty Online TV for continue for the online, now for send we you support.
Now for send we you support through the orange money number where you see on the screen and the other bank details them as well for make we continue for do we work. This na Liberty Online TV 1 year celebration. Na Liberty Online TV, all voices count.
This one way we all friend we safe, now nobody own. You want to get what you want, we go down to belly.
It's a brand new song for our customers.
where the bank with us all over the universe.
Save small and win big. UBA, they celebrate 75 years of better banking service. And na Salon, the bank done there for 15 years now. This na big celebration, and we want give back to we wonderful customer them. We don't make we business go find one for the past 75 years with the UBA Savings Legacy promo. Save small and get your own share on this 350,000 loans. 30 customer them go get the chance for win cash prize every quarter. Just put 2,000 loans and above na your account. And the more you put 2,000 and above na your account, na the more you go increase your chance for win more. No wait to capu the chance now. Your legacy starts today. The draw them go happen inside September and December 2024. Join UBA for celebrate 75 years of excellence. UBA, Africa's global bank.
Money in my pockets, from what I want correct. Customer service with excellence. Now that's make with the top, now the continent.
As Liberty Online TV, the 1 year inside this November, we dey celebrate this anniversary with different activity them. And one of them, na hike with Liberty, we get for be Saturday, November 16. Usa we go waka go na the Mambo waterfall. The Liberty Online TV team go then na Mambo Junction, they wait for una 7 o'clock na morning. For join we, na 300 loans no more you go give, and you go get the Liberty Polo and water, and you go get all the enjoyment. We get for being at the waterfall. If you want for join we, you go come now with 33 Battle Street office as the Polo then already now, or call na this number 074 200 545 for place you order. Now Liberty Online TV, all voices count.
Alright, welcome back. It's still the breakfast show on Liberty Online TV, and from that last message where you just get, remember for hike with Liberty on the 16th of November, Osai, you go just get small money, 300 loans, you know, and they're part of this great team. Like we work at Mambo Junction and go up now the Mambo waterfall, and also not forget on the 29th of November, now the great dinner and dance with the team na Liberty Online TV. You know one for miss out. You know one for miss out for see we dancing moves them with all na Liberty Online TV. And you also know one for miss out the opportunity for we get a picture with we all na the team na ya as we go get for meet na the view rooftop. Also we go get for celebrate Liberty Online TV 1 year of broadcasting. And I go remind you now quickly the tickets price them for the dinner. The ordinary tickets na 250 loans no more. We get patron single when at 6,000 loans no more, and also table for 3 5,000 loans no more. Not forget the dates, the 29th of November and also the 16th of November. Now two important dates and then your calendar where you go for day for continue for join we for celebrate with first year anniversary in Liberty Online Television. Well, we continue with the breakfast show, and we still get Dr. Jadwan at the studio with me this morning. And they talk about the 7 days ultimatum when at the latest one with just give to governments now for extend for let them ensure say then give the doctors them the fuel supply we then supposed forget. But now at same follow we look at issue we get for do with the Ministry of Health, the response we then get to all of them concern here. Alassane?
It's continue for watch the program now, the Liberty Breakfast Show. We quickly go look at the issues we get to do with the Ministry of Health. As Tuesday, October 22nd, inside the Ministry of Information and Civic Education, then press conference, the Ministry been host the Ministry of Health, which had been update journalists them, but the step where the Ministry don't take for CC, they address the concerns them with doctor then they raise for see they meet the deadline we then don't give the government. Mohamed Kamara gets more and gonna report.
The Ministry of Information and Civic Education, inside a weekly press conference, where it happen, who side and invite different stakeholders them for provide updates to the public, but then work. Inside the Tuesday, October 22 edition of the weekly press conference, where the ministry be all with journalists them, the Minister of Health, Dr. Austin Demby, first start for provide updates, but the press release where Dr. Dem be pulled this BNTM.
So a critical piece for all of this. Now, for letting come to them get fuel, for they're able for go walk. So that will be very, very vital, because as a part of the terms of service, as a part of their employment, the government agrees say all the doctors when they enter at grade 9 and above, they entitled to 45 liters of fuel a week. But not to doctors anymore. All healthcare workers, in fact, all of the civil service at grade 9 and above, they're entitled to this. It also said the Ministry of Health get the largest number of people that will qualify for this. Get over 500 doctors and over 800 nurses that qualify for this. The bill for the doctor, they know, for every quarter, now 7.5 billion only owns, 7.5 million euros. For the 2 quarters, now 15 billion only owns, 15 million euros. For the year, now 31 billion euros only owns, or 31 million.
Dr. Austin Demby same also explain about how government don't respond to the strike action where doctor them want for take.
So the first part now, I just got a meeting with them. Yesterday we get 2-hour meeting at the Ministry of Health. Today we're going to have VP office to get another nearly 2 hours of discussions around now. Within the Ministry of Finance don't say, we go supply the fuel. But it based on how we get this money, we go make sure say, you not the fuel, we'll privatize now. But then we'll get the money first, then we'll make sure so we get that. So the government will commit now, say, July, August, September, we'll pay on that. Even October, November, December, even before that time, we'll pay on that. So the second thing now when they ask, say, okay, if I do all of that, how we go assure say going forward now, we know they can't visit the answer again. The discussion I would say is, let me all come together, how we see what's in the option, because the government not saying no. The government is saying, yes, we will support now, but all support now based on how the money they come. We will always prioritize now. Now we just know no more. Right now, when you combine the bill for the doctor, then you combine that with all of the nurses, that fulfill all of the field no more, fulfill all of that. Now over 67% of the whole ministry the operational budget.
Which bring about the delay for provide fuel for doctor them. Dr. Austin Demby began this for say.
This year we struggle small bit because of the economic situation of the whole wide world. Some struggle. But if we say in spite of that struggle, they were not able to pay the first 2 quarters, the first 6 months of putting the government on them, we don't pay the money. What's outstanding now the 3rd and the 4th quarter. So July, August, September, we just don't done. October, November, December. So the doctor they say, let me pay this money. So the Ministry of Finance will say, okay, well, fine. We just struggle small bit. One pay salary and first and all that. But after one pay all that, we'll make sure say we prioritize the doctor then fuel.
Dr. Austin Demby end up say, governments go ensure say them provide fuel and other support to doctor them as way for help promote well body business in the country. For Liberty Online TV, Mina Mohamed Kamara, the report.
Well, that's not the response where the Minister of Health and Sanitation, Dr. Austin Demby, being made yesterday regarding the concerns where the doctor then gets as being a part of the government's weekly press conference. Also, being talk about waiting and they do now for ensure say they honor the request of the doctors. Will they come over to you, Dr. Jadwal, although you are about for leave the studio for attend to other official engagement? We just don't hear it from the minister, not that government someone forget. According to Ram, he said and they promise us say when governments get the money, then go give on a fuel them. With that kind of statement, on a thing say magic go play inside the 7 days, we don't give us other ultimatum for let governments get this money for supply on a fuel, being that instead don't talk the money they run into billions.
So as at the statement with 2 initial ultimatum will be key. 1, give backlog January to July or to June. Then the other one, more get a permanent solution. Not every time after 6 months or after 3 months, after 1 year, before come back and ask. We believe say the fear for the can uninterrupted. When the time come, we forget her. Yeah. So we are going to the meeting, as you rightly say, the ministry, after we don't get to this point, I say, well, that they give for the last 2 quarters one say. So we'll be surprised though. We say so the last 2 quarters we not be even asked for now, it not available for loan give. And we believe say if you're available, fine, because I say money available now they give. So they can, but at the same time, if they don't go, we not create any issue for that day because of we believe say we not work for them. We not believe in taking something, we not work for it. That more make it very clear. But they say they give ahead where it's fine. Maybe now that the government want use to the Minister of Health as a waiting for show say indeed they're committed for with the good we feel uninterrupted. But just have a hope see like not the usual thing, like where you picking in a house, they want something, after they don't cry, they get sweet. You say after they don't think it's sweet, they after the sweet don't done, then the other time you know say it don't done end. For like come back again for difficult. We believe say we all to the push for I'm gonna get something consistent. So when the quarter done, we won't forget the FL. The proposal was at least if the quarter done inside March, for example, we get April done. That don't go 4 months, eh? If April done, enough forthcoming, then inside May not for done if we come. Because we believe say enough will go beyond that 2 month day. Because we already wait for 3 months plus extra 2 months, 5 months than day. So that day we they push for. But if the government don't say that they give it that day because of what it take for the money and everything, and as yet this is our entitlement, we not even ask for thing we for other things we entitled to. This is the thing at the basic of the entitlement. We entitled to not to like a new demand we make, not to like a big with a big for, not to like a request. That's something we statutory by law. Who forget. Yeah. So I make one statement that I say they going to look for 5,000 doctors for able to take care of the populace as alone. If we struggle for take care of less than 500 or less than 600, how we go for do if you reach that number day of the 5,000? How we go for do? So with all this kind of thing there, it is send like some message to the hope for the future is very blink. And the best option we young doctors there get at the mind is where that statement was. We say the best thing for do now for left here and go do all that thing, because if they never take care of food now at this point and they will even go to for entitled to, and now the money they run into billions and the government not able to sustain and they go for sustainability, then the best thing for do are for it. So all what we believe in a parity. We say if the healthcare is prioritized, doctors they be prioritized, the health of Sierra Leone prioritized, then that money for be available.
So those assurance you go left for the public as you left with for say if they're going to any health facility today throughout the country, on doctors and they all over the work.
Doctors all over the work. Then I give them 100% assurance. We don't tell them yesterday night say each and every doctor to we WhatsApp forums. We don't tell them say today as usual each and every doctor for go for at least till next week Friday. Why is to go they address the other issues there?
Alright, well, many thanks for joining us in the studio this morning. In name Dr. Jajua, he came here also this morning on behalf of the Sierra Leone Medical Dental Association. As according to them, they want for start and strike action today, but they look into the consideration, say they want for save more lives, so they give government 7 more days for ensure say they address and concern them. Many thanks for joining this morning.
Yeah, thanks very much, and it was nice having me.
Alright, so well, when I continue for sending a message them, we go ensure so we read on a message them whether they come in regarding this issue we get for do with the doctor them. One for say many thanks to Dr. Jajua. We continue with the breakfast show and they look at that issue we get for do with this same concern regarding the strike action where the doctors then be one for make today, but according to them, they don't push and force and they give government 7 days we go elapse by Friday for ensure so they look into the concerns them we get.
Let's continue for watch the program now the Liberty Breakfast Show as we bring into plenty of the issues them we the inside we basket this morning. Where we'll look at this one we as doctor then we the part of the Medical and Dental Association don't see them go strike Wednesday October 23rd. Make Liberty online team go work on a certain partner Freetown for talk to citizens and where they access government hospital for talk about waiting then think about the health sector and how best and we assess the facilities and we the different hospitals and they give. Well, we reporter to share if we get more and we'll now report.
The health system at this country is very poor. Very poor. Because middle close to corners, like you see how people in the street, how people in the sofa. We check down here right now, you see about 3-4 people in the dorm. Where they need medicine, they need medical, but like the medical system in this country is very poor. I remember the last time I'm not be well, so like I mean the police usually cut me and so like I'm gonna come out for me to attend to me first and get inside the CR for go get this stuff for go take people all that stuff then they so like it's very poor. Government need for putting things in place.
So what if you say that the team government for because you say the important people then challenge and the patient like you do?
Government needs the government needs for I mean put people in at the hospital level. But then put stop to reach the gun at the country. So we go to hospital if na plaster said we now for free, then they tell you say for bad. So government need for put people in we for the stop dancing in the
well actually the current health system we can salon in Paul really. Because actually like when person is sick they go to hospital. The person is sick they go to hospital. They go ask for money. Really, they be safely head and what is said. For now, because we sick now, we go to hospital. They must ask for money. We see.
So you don't ever get experience where you go to the ask for what they're not supposed to ask for?
Of course. The last time, I'm not be the feed me body fine. Really, I go to hospital for like go get medicine. I feel saying that we go the medicine where they tell me say, forgive me. They say pass I pay money. So really, I pay the money. No, actually, me, I agree to the government and they take action with that. Really.
As for me, because I don't care what we brother and picking the first, now first be sick. We go there in a cottage. We go there. The concern where they get for the picking be the critical condition. We go there no attend to it quick. Pass connection, my brother be get some connections. Then they will big brother so nine they link and so where they later begin attend to the picking. Where you go they no get stable you the strain that moment there. But if you carry money, they attend to you. Because me the tell I carry on me picking so person not be there with me because I be sick and critical way so now be emergency sick and be sick, you know, they don't for too long. They tell I observe and I say the sick is worse. Now me self total go to the hospital. One go there where I give money they attend to me quick because like me one agree I don't be get person near me. So like I not be they stinge me and follow they not attend to me picking. I be they make that free way they follow they attend to me picking. I even buy blood they attend to me picking. But if you don't get money you they go hospital. You say they depend on the free health care. They need able to attend to you picking because when you don't get money, they need to watch it. Then go begin to say now for do ajo any south side and direct way you go, you get money. Any side so far where you go, you get money. I can say free health care there, but me not say free health care there because if you see you don't get money, where you go hospital, you go ask again.
So what think government will do?
I think they get for offend, surely them put on for this money issue because like we now where they strike, if we begin sick one kind way we go able. Like if we get money, we go give. But the other one then now, everybody are not all the same. Some people in the way they can sick, they no can get. We now what they come up. Me the one women we can always tell me say where you get money they keep aside in case of if you get sick or you get emergency something you can watch up and use them. So you see. So like the one that we not get now, let them try for make solution for them. Not to everybody gets, not to everybody and then are the same.
But if you not get money, you're not able to get to picking. And like if picking they die fair for you, the big person they die once you not get money. And then they watch you, no one know about you. But if you get money, you spend, then go able to get you picking. Or treat you.
You don't ever get experience where you can go person in hospital.
Yeah, it's like I can go to me picking them so.
What exactly happen?
If I not get money, you need to treat them. proper. So you go left planning out say because I don't see what experience you go left planning out say so say God take you picking life before them.
Now which hospital?
Cottage. The government help we the one day we not get. But right now not easy. We the businessman. Business no dey pass fast. Money no dey. So if you tell the carry picking hospital, if you not get that, it's let the government help.
All right, welcome back. From that report, we reported Duma to Sheriff for Sika, the health condition na Sierra Leone. They continue with the program Liberty Breakfast Show, as we will look at few messages that we don't come inside the program, Mabel.
All right, so the look at message, I go begin for read from the YouTube channel. Usai, the first message we'll go look at. Obe Kamara say, regarding the APC issue we've been doing with the police, Obe Kamara say it is unbelievable that the APC leadership can invite police to their party office. It seems they didn't learn anything from the police.
This one I would take from we Facebook page. Come up from Mystic from Dwazak. He said our doctors deserve better working facilities. I'm urging them to hold on because they are vital in the day to the running of the government, hospitals and PHU. As for me, the Minister of Health and the Minister of Finance, they need to set up the process so that the actions of the doctors will not affect the ordinary Sierra Leoneans who need their services.
All right, so look at more messages. We don't come in at the YouTube channel again. This other message we're going to look at from Obe. They say the government should take the doctors seriously.
The next one I will take the come up from Jibril Samfa Bangura. They say if the detainees have indeed been released as confirmed by the police spokesman, why then there is an ongoing dispute on the social media between the All People's Congress Party APC and the police.
We look at more messages. This other one I will look for the Mustafa to say. The doctors are right to request for their own share because politicians are sharing money amongst themselves by increasing their salaries and allowing more allowances to themselves. And in essence, people, particularly politicians, are paid salaries for savings because they get allowances for almost everything. In the West, they get bonuses, but cost of running your vehicle, fuel, wardrobe, toll gate, etc. They have to use their salaries for that. The president is going all around the world to gig for help, but most of that goes to salaries. What a special country.
The next one I'll take from we Facebook page. It come up from Bashir Lucky Son Mustafa. The doctors are suffering, but the ministers are enjoying all type of pleasure within the laws of Sierra Leone. This is sad. There is no equality in society, and this is not fair enough. The president can travel up and down, but cannot provide the need for the doctors who are saving lives.
This other one from us friend Kamara is say, for our nation to achieve a sustainable goal on health, the national health system must be strengthened by developing a national strategy, surgery, obstetrics, anesthetic, improving some mechanisms. The issue of inavailability of every health sector settings. The patient's journey in recovering well must be tailored to meet with primary, secondary, and tertiary health care needs. It's stressful for doctors to be under-resourced with materials and infrastructure that's meant to care and manage the patient's needs.
The next one they come up from Fode Mustafa to in our Facebook page. It says that the doctors are right to request their own shares because politicians are sharing the money among themselves by increasing their salaries and awarding more allowances to them. In essence, people, particularly politicians, are paid salaries for serving because they get allowances for almost everything. In the West, they get bonuses, but the cost of running your life, like car, fuel, and other things, are essential.
All right, well, many thanks for the message and the way you send at this edition of the Liberty Breakfast Show. And I just want to remind you that say November, now the month of celebration for Liberty Online TV as we turn 1 on the 13th of November, and the public will start for celebrate with we officially on the 16th. Also, we go get forget we hike to Mambo Waterfall. We go converge na the Mambo Junction. 7 o'clock in the morning, the team go down there, they wait for us so that we all go waka go na the Mambo Waterfall. And for be part of that, like we always on the tell una just 300 leons una go get for gi. And instead of 300 leons, we will ensure say una go get one polo and una go get water. And we all go happily waka go na the Mambo Waterfall. And also we go forget the climax of the events all the way we do now on the 29th of November. Also we they get the dinner and dance. You know, right now Al Hassan and the rest of the team we do in-house practice and rehearsals for the dance because now we go for starts for open the stage for dance. So I mean, you know, for mistake opportunity that they for see the likes of Khadija Bangra dancing on stage, Mabel Kaba dancing on stage, Alex Lawrence Kuroma moves them, it don't improve on them.
Of course. And we
got a lot of other people, you know, where already we don't ensure say on a daily basis we get session. Also, we just
Mabel, you know, what's good about the show is an exciting show because plenty people want to know we presenters, we reporters. So of course, there's an opportunity for let them see Liberty staff on that very day.
We can have pictures.
Of course.
You know, they can say pictures, them they bring memories, and also you know for me the opportunity day. But go meet with the team on the 29th of November. So make sure say you calendar the most important dates for the November. Now the 16th, where we go forget we hike to Mambo Waterfall, and also the grand dinner and dance on the 29th. Remember, so you say for the watch the Facebook page. We don't tag we all the information we need for know about we bank details them on how you go support this particular venture. Not just limit them to the ticket price. And maybe you want for do more. Maybe you want for give we cameras. Maybe you want for give we equipment them for ensure so we're able for continue for do we work.
We are open up,
yeah, we are open to any kind of support we get. Not just limit them to the ticket price them. Where I go over them once more. The ordinary tickets for the dinner and dance when at the 29th of November. The ordinary tickets now 250 leons normal. Single patron na 6,000 leons normal.
I just like that word normal.
Normal, nothing much.
Nothing much. So be part of the celebration, you know, support Liberty Television and see how best we were able to take broadcasting journalism to another level because we are top notch.
Yeah. And we got a lot of goodies where they come inside this 1 year. We got a lot of things so we go really show us say we don't do and we want for do more as the year then they unfold, but we need our support for ensure so we keep this particular space as an independent space where nobody no go evading. So we production especially because the contents the Always Liberty Online TV they bring come to una. Now we waiting I also they sit down, we discuss and look out for issues and where we know say they of national interest. We bring and come to una and we always make sure so we get every side of any story where we cover na Liberty Online TV. So many thanks to una for believing in us, and this is not time for una give back to we. We don't there for 1 year almost, so this is not time for una self give back to we for we continue for the online. So now this edition of the breakfast show go left una many thanks to una all. We don't watch, share and tell more people about Liberty Online TV. Continue for do that. We they continue for ensure say we protect this space for be the only digital platform where independent and we they bring come to una factual stories at all time. Now Princess Spears produced the program. Many thanks to the technical team, Musa Sao Kuruma, Emmanuel Manley Campbell, and also Abdul Kuruma for the support we then give for ensure say the program meet tonight. Until we meet again, we welcome to say goodbye.
And me Al Hassan Kuma, get yourself a pleasurable day. Bye bye.
Liberty Online TV the 1 year this November, and you know what's in that mean.
And throughout the month of November, na celebration period. And as you know, na time we for coming and support Liberty Online TV for continue for doing work.
And the way how we go support Liberty Online TV for continue for the online, na for send we you support.
Now for send we you support through the orange money number where you see on the screen and the other bank details them as well for make we continue for do we work. This na Liberty Online TV 1 year celebration. Na Liberty Online TV, all voices count.
This one way we all friend we safe, now nobody own. You wanna get what you want, we go down.
As Liberty Online TV dey 1 year inside this November, we dey celebrate this anniversary with different activity them. And one of them na hike with Liberty, we get for be Saturday, November 16. Usa we go waka go na the Mambo waterfall. The Liberty Online TV team go then na Mambo Junction dey wait for una 7 o'clock na morning. For join we, na 300 leons no more you go give, and you go get the Liberty polo and water, and you go get all the enjoyment we get for being at the waterfall. If you want for join we, you go come now with 33 Battle Street office as the polo then already now, or call na this number 074 200 545 for place you order. Now Liberty Online TV, all voices count.